What is up, everybody? I was on a little bit of a hiatus from anything to do with my personal social media for quite some time now. Had to do with not only school and work and everything, but what the title of this video is about is my personal experience dealing with a microdiscectomy and a herniated disc, bulging disc. And Cora will be joining us, but I was about to head out, but I've been meaning to make this video because I know that I wish something like this had existed when I was going through everything with my herniated disc. So I've seen a number of videos talking about their experience with herniated discs and bulging discs and whatnot, but never really seen it from someone's perspective like myself. Like, I'm only 21 years old at the time making this video, and I don't think I've seen someone tell a story about their personal experience with the herniated disc at such a young age. And crazy to think that I started having this pain on my right side. It was an L5-S1 herniated disc when I was 18, 17 years old even, which is so crazy. But I just wanted to take this time to talk about my personal experience and kind of everything I did leading up to surgery. And as of right now, I'm actually a month post-op, so I'll be touching a little bit on that. But it's so crazy because I can't really think of an exact moment or something that really caused my herniated disc or the pain I felt in my lower back, butt, hamstring area, all along my right side. But I remember, though I don't think this was the causation of it, a few instances when I was about 18 years old. One of them, I bent over to pick up a pair of socks, and then when I picked it up, I just had this sharp pain in my area I had just described, and I remember not even being able to walk up the stairs. Following that, I remember at the time I was working at a local smoothie shop, and one time I had bent over at the register just to get something, and it was the same thing, this pain that was just this stabbing in my lower back, butt, hamstring area. This had kind of been going on, and this common discomfort that was not nearly as severe as either of these instances, but it was just going on for about 2 months now. And I met with my just regular doctor at the time, and he was saying, you know, this might just be a little strain, you might have pulled something, so let's take a break for about a month and take it easy. No exercise, no super physical activity or anything, and it should go away on its own. And I just remember right after that meeting, I think it was 2 or 3 days later, the pain was so bad in that area that I actually went to urgent care, and then the doctor was like, oh, you know what, this is probably something that's more than a strain, why don't we go ahead and get an MRI set up? So we had scheduled the MRI, and like I have learned throughout this process, insurance is everything. So before we could get the MRI done, we had to go through physical therapy. This physical therapy was not like specific to my herniated disc, because at the time it wasn't really diagnosed that I had a herniated disc. So we went and I had to do, I think it was 2 months of physical therapy, just like general physical therapy in the area where I felt pain. And seeing that I felt no sort of, like the pain wasn't being alleviated at all, insurance did approve the MRI. We got our first MRI, results came back. And mind you, like, this is the time that it took to schedule the MRI, the time it took to get the results back, the time it took to meet with someone to go over the MRI results. I think that was like another month. But that happened, and then the MRI results showed that there was a severe herniation, bulging disc in my L5-S1 region. Me specifically, it was on my right side. And where did we go from there? The person who was going over the MRI results with me put me in contact with a specialist who I've been seeing for the past 2 to 3 years. So I'm trying to think what was the first thing my specialist recommended. We had kind of talked about surgery as an option, but at the time I was only 18 years old, I believe. It's so crazy to even kind of like recap this. I'm just thinking in my head like, whoa, I've had this pain for so long, but Cora. But I think the first thing she recommended was she had a really good physical therapist that was much more specific and has dealt with herniated discs and just like sports injuries in the past, which what we were really thinking, what kind of caused this herniated disc was just being physical. I was working out pretty regularly. I was playing sports extremely often, and whether it was from that or just a combination of lifting incorrectly or just a combination of all of that, we think that was kind of the causation of this such severe pain. So went to physical therapy, and I could have certainly been better about doing my due diligence and doing all the stretches that I was prescribed, but it just got to the point where I was prescribed these stretches and I was supposed to do them, upwards of 10 times a day, and it was like I was just trying to live my regular life, but I couldn't. But nonetheless, I should have been much better about doing my stretches, but I did do them relatively regularly, and even doing that, I didn't experience any sort of relief. So next on the list, we did so many other things. Throughout the course leading up to surgery, I did 4 steroid injections, the cortozone shots, and all of those were kind of temporary relief, never anything more than 2 months. So we did the 4 cortozone shots, we did chiropractic care. That was kind of a stretch, but we did just want to kind of try all of our options before we went into surgery. So I met with a chiropractor. I really did personally like working with him, but it was kind of just a cool experience for me because I've never been to a chiropractor or anything, and just like the way he realigned my back and just everything was kind of interesting. But honestly, I felt more pain after chiropractic care than I did before. So we cut that after chiropractic care and my second time of physical therapy, in addition to the cortisone shots. Something that I stand by, we did acupuncture. So it wasn't until about my 4th or 5th acupuncture session that I actually started to notice some of my pain and discomfort go away. Certainly not enough to the point where I was like, okay, we don't need to do surgery. I can live with this. This is tolerable. But if any sort of pain was alleviated, I would say that it was primarily due to acupuncture. I had a really good experience with that, and I highly recommend that to anyone. After kind of acupuncture, we had been doing that for a while. We had been trying all these other things. I forget exactly what it was called, but we did this electro-stimulation something. They put these kind of patches all over my leg and kind of back and hamstring area, and they kind of shocked my nerves or something. That was probably the weirdest feeling I ever have had, but once again, kind of no relief from that either. So I'm trying to think if I missed anything else we did. We did massage therapy, of course, just the occasional massages, and though it felt good at the time, a couple days later, it was just right back to that constant and continuous discomfort. Cora, oh my gosh. But we did try and kind of exhaust all of our options up until the point where I was still able to be extremely active pre-surgery, but it was just this continuous discomfort that was so prevalent. I remember driving in my car, just the mere action of sitting down was even so uncomfortable. I remember having to stretch my right leg in between my gas pedal and my brake just to stretch it out while driving because it was just so uncomfortable. So many daily things that I can't even remember the last time I didn't feel that pain, but it was just every day when I was sleeping, it was rather difficult to just lay in bed in certain positions. If I would sit for long periods of time, I would experience so much discomfort. I couldn't remember the last time that I was able to actually bend over and touch my toes on my right side or do any sort of stretches on my right side because just that kind of L5-S1 herniation was so prominent. It just, so many actions and just positions were so hard for me to do. It was extremely uncomfortable for me. Though I was still living a pretty active lifestyle, I wanted to, live a normal lifestyle where I didn't have to worry about that, especially at such a young age. So fast forward 2 to 3 years, we decided to meet with a surgeon who was had great reviews in my area, and he kind of talked to me about surgery and how low risk it is, and how patients similar to me have visited him and had great results. So we finally pulled the trigger. We went ahead with a minimally invasive microdiscectomy, and I am now, as of the time making this video, 1 month post-op. So that's really cool for me. And just a little bit about some of my recovery process. I remember I was super nervous about the surgery. I was watching all these YouTube videos and whatnot on microdiscectomies in general, because I was from someone who's so active, I couldn't imagine, the horror stories I was reading on online forums about the recovery process and whatnot, even though my surgeon had kind of told me that, hey, it's not really too serious of a surgery. You're going to be back to normal in no time. Nonetheless, I was still got caught up in readings on forums and whatnot, but nonetheless, post-op, I remember immediately post-op, the first 24 hours, I felt good, not 100%, but so much better than pre-surgery. Though that was primarily due to all the drugs and coming off the anesthesia and all of just the medication I was on, it was just crazy because the only pain I really felt was the incision point that they did in my lower back, which has kind of left like a cool little scar. But I remember coming off of that medication, kind of the 3 to 5 days after surgery, the pain had sort of crept back. And I remember how just like depressed and sad I was feeling because I was like, you're telling me I just went through back surgery and now the pain is still so prominent in kind of my lower back, butt, hamstring area. But, you know, I had met with my surgeon about a week and a half after surgery and I still hadn't even felt a whole lot better. It wasn't for me until about 2 to 3 weeks was that when this residual pain slowly started going away. And right now, I'm looking at the camera right now, and this has been an 11-minute video, and I've been able to sit down the whole time. And though that may seem like nothing, but for me, to be able to sit upright just normally and not even experience any sort of pain in my L5-S1 region is so crazy to me. But I just wanted to say that kind of the 2 to 3 week window was when the pain started to actually go away. Like, it is so crazy to me, but though I was a little skeptical kind of if surgery had worked, if it had not worked, the first, week and a half, it wasn't until now I'm kind of on my 4-week, coming on my 5-week period post-op that I'm really noticing some great just pain relief. And it's crazy, though I'm very limited to what I can do in regards to like bending, stretching, lifting weights, just because that's the typical post-op recovery process. I feel great and I'm able to actually like bend my leg. I feel, honestly, dare I say it, but close to 100%, though I'm being very particular about my recovery. I'm icing, I'm heating my back, I'm trying to really not lift any weights, really not do any sort of uncomfortable stretching or bending or anything. I'm walking every single day. But yeah, it was just, I personally, not until about 2 weeks after the surgery was when I really noticed such amazing relief. And I just wanted to let people know that if you're at all skeptical or if you're kind of questioning surgery, I wish I would have done it earlier. Though I'm happy we kind of had tried all of our options. That way we know it didn't work, rather than me going through surgery and just thinking, what if I would have tried something else. But I have a huge smile on my face just because I know that I'm so much better off now than I was before surgery. Though I'm only about a month post-op, I'm hoping that continues, and just how I feel right now, it's more than enough reason for me to recommend surgery. And there was really nothing too crazy after post-op. I just remember really the incision point was the primary area of pain for me, though I went into surgery not nearly as severe as some people that go into the microdiscectomy. I just remember the recovery process immediately after surgery. I was off medication, I think, 2 to 3 days after, and I don't even remember needing to take any Advil or anything. I'm not saying that you're going to experience exactly what I did, but if you're someone who's going into surgery and lives a rather active lifestyle, I think your recovery process, like mine, will go by pretty easily. I'm just excited to get back into sports and physical activity and whatnot, but we're kind of going to go through post-op physical therapy next, and hopefully from then I'll be able to return back to like an active, normal lifestyle. That's kind of my story with my herniated bulging disc. I think I forgot to mention that post-op, we tried a number of medications as well, that I remember like some of the side effects from these medications, and please excuse my lack of terminology and whatnot, because I don't remember the exact names of all these medications, but I'm sure I could do a little digging or just look back at past paperwork and figure it all out if anyone's curious. But I remember some of these medications just made me like so lightheaded, so tired, so dare I say some of them made me depressed and whatnot, that it wasn't like, gosh, if you're telling me the only way I can like function in my daily life without this this discomfort in my herniated disc area is with this medication, like, you're kidding me, like, sign me up for surgery, because some of it was really bad. But there is hope, there is light at the end of the tunnel, because just the short span after surgery, I feel great. For anyone who is rather young like myself and sort of has this reoccurring constant discomfort, I hope this video provided you some value. And if you're thinking about getting surgery, I just want you to know, based on my personal experience, I highly do recommend it, and I'm happy that I did it. Certainly consult with your surgeon and your specialist and whatnot, but yeah, I think that'll do it. I just know that when I was looking for videos, there wasn't really anyone speaking from a perspective from my point of view. I had watched lots of videos of post-op, and everyone's post-op is going to be a little bit different, but if you're going into surgery kind of like I was, I hope post-op recovery is as easy and as beneficial as it was for me. So I think that's going to do it. Not really like videos I've normally made on this channel, but as I've mentioned before, I hope this video provided you guys some value, and I wish you nothing but the best. Feel free to leave a comment below or get in touch with me if you have any questions or concerns, or just want to know anything about my recovery and my herniated disc past, and just if I can help you in any sort of way. I know that it really helped for me personally, being able to hear about other people's stories with their microdiscectomy and their herniated disc. But I think that'll do it. All right, so this is me and the puppy signing out. Thanks, guys.